Hi, my name is Umair Khan, and today my topic for the One Health seminar presentation is cholera. Before I begin, just a brief introduction about cholera. It's one of the oldest diseases of the world with a pandemic potential. To date, it has caused about 7 pandemics throughout the world. The table over here basically lists the different pandemics that have occurred in the past couple of centuries. And as you can see, that most of them were centered around India, Southeast Asia, and the Asian countries. So it's safe to say that cholera has usually caused, or it's more of a pandemic or epidemic in developing countries. Cholera is an acute diarrheal disease that can kill anybody within an hour if not treated promptly. Each year, about 1 to 4 million cases of cholera are diagnosed, and about 21,000 to about 150,000 deaths are reported worldwide. Cholera has a case fatality rate of more than 30%. That is, if they are not provided with any prompt treatment. Obviously, the case fatality goes down if the patients are given prompt treatment. But in most of the cases, in developing countries, especially, treatment is not provided, and that's where the case fatality rate is pretty high. 80% most of the treatment for cholera is through IV hydration. About 80% of the cases are treated with oral rehydration therapy. Cholera is a public health threat, and it is basically an indicator of health inequity and lack of social development. Recent research has suggested that fish might be a possible reservoir. It is possible that fish may protect the bacteria in unfavorable habitats, while the bacteria may assist the fish to digest its food. There's also a possibility that fish may disseminate the bacteria in the aquatic environment and may transfer it to water birds that consume them. So as of right now, it's safe to say that fishes might be a plausible reservoir for Vibrio cholera. The cholera disease is usually caused by a bacteria called Vibrio cholera. It's basically a comma-shaped gram-negative bacteria. It usually colonizes in the small intestine and induces fluid hypersecretion through the action of an enterotoxin. That hypersecretion usually results in diarrheal symptoms. Now, what is the pathogenicity of Vibrio cholera? So once the bacteria Vibrio cholera infects the small intestine, it secretes an enterotoxin. This enterotoxin then binds to intestinal cells, which causes the activation of the chloride channels. The activation of the chloride channels causes the chloride ions to be secreted into the gut lumen. And with the flow of the chloride ions into the gut lumen causes a high osmolarity in the lumen of the gut, which causes the water particles to also move through the intestinal cells through the process of osmosis, which causes the fluid hypersecretion, and eventually it causes diarrhea and diarrhea. This diagram basically illustrates how the Vibrio cholera causes the fluid hypersecretion. Over here we can see that the enterotoxin binds to the intestinal cells. These enterotoxin then causes the activation of this enzyme that catalyzes the conversion of ATP to cyclic AMP. And because of this activation, chloride ions basically move through the bloodstream, through the intestinal cells and into the gut lumen. When these chloride ions move over here, water also follows through that because of the high osmolarity. So there are several risk factors that are present for cholera infection, which include inadequate access to clean water and sanitation facilities, overcrowding usually seen in refugee camps and peri-urban slums, eating raw or uncooked fish, hypochlorhydria, which is basically low gastric levels. The lack of enough gastric levels allows the bacteria to survive through the gastric juice's acidity and pass on to the intestine. Another risk factor that has been known to be associated with cholera infection is type O blood. Why this is associated, the reasons are not clear yet. Still, there needs to be further investigation as to figuring out as to why type O blood is a risk factor. And children and elderly are 10 times more susceptible than adults due to their compromised immune systems. There are several symptoms that are present, but most predominantly, patients with cholera infection come up with profuse, painless, non-bloody, watery diarrhea. This diarrhea is also known as rice water stools. Patients can also have symptoms of vomiting, cramps, and severe dehydration. Usually, cholera is a waterborne disease, so most of the transmission is done through contaminated water and food. About 88% of all cases of cholera are attributed to unsafe water, sanitation, and hygiene. There are several complications that are associated with cholera infections if they are not treated promptly. The most important one is the intravascular volume depletion. That's because of the fluid hypersecretion. The body loses a lot of fluid from the system, and that causes intravascular volume contraction or depletion. Patients can also have electrolyte imbalance, which can lead to metabolic acidosis and hypokalemia, which can further complicate into cardiac arrest or cardiac arrhythmias. Patients can also have hypoglycemia, which can further go on to cause seizures and coma. So diagnosis for Vibrio cholera or cholera is usually done through clinical presentations. Patient symptoms and the presence of risk factors kind of let us know if the patient has cholera infection or not. Other tests that can be done in order to further diagnose um, cholera is through stool culture or looking for the cholera toxin, or you can also do the cholera rapid test dipstick. Treatment for cholera, the mainstay of treatment for cholera is basically aggressive rehydration. We can either do it oral rehydration or IV rehydration, depending upon if the patient is able to drink water through his mouth. We can also provide them with antibiotic therapy, and we can also provide them with supportive management for other symptoms, including vomiting or nausea. So over here we have the different antibiotic regimen that could be used based on the patient population. So for adults, mostly we can use either doxycycline, ciprofloxacin, or azithromycin. For pregnant patients, we can use erythromycin or azithromycin. And over here we have the different pediatric populations and their regimens, specifically what we can give to pediatric patients. So the One Health implication, or the One Health perspective with regards to Vibrio cholera, is that we live in a very globalized world right now. There's frequent travel throughout the world. People traveling from developing countries to developed countries have a potential of carrying the bacteria with them to different parts of the world. Along with globalization, we also have food and animal products that are being transported throughout the world, from between different continents, from one end of the world to the other. That can also increase the risks of transferring the bacteria. And due to the 21st century, a lot of people are living in major cities, which causes an increase in the population density, which results in overcrowding situations, which is further a risk factor for outbreaks for Vibrio cholera. Eating raw or uncooked fish, possibly we eat a lot of fish these days, especially in the form of sushi, which is raw and somewhat uncooked. So that could also be a risk factor for cholera infection. Global warming is also taking place, which is causing the water temperatures to rise. That rise in water temperature might be providing an optimum conditions for the bacteria to grow. And we're also using a lot of antibiotics, which has the potential of causing drug-resistant strains of Vibrio cholera to survive. So how do we manage patients with Vibrio cholera? First and foremost, we got to provide them with safe and clean drinking water. We got to provide adequate sanitations. We got to do economic development. We got to implement cholera surveillance programs. We got to educate the communities. We got to educate the people about how to reduce the risk of getting cholera infection, and promote adoption of appropriate hygiene practices. So we can also provide safe preparation and storage of food and water. We can provide them with avenues for safe disposal of feces, for example, for children diapers. We can also provide them awareness campaigns that should be organized during outbreaks and information regarding signs and symptoms of the disease and where to seek prompt treatment that should be provided to community members. The most important challenge in treating or eradicating cholera is that patients are not able to get access to healthcare, and we need to provide them with avenues. We need to show them different avenues where they can reach out to if and in any case they come up with symptoms of cholera infection. We can also provide them with the vaccinations. Currently, there are about three oral cholera vaccines that are present in the market. They are Dukerol, Sancol, and Ubicol Plus. The WHO has a global task force on cholera control, um, whose aim is to reduce the cholera deaths by 90% by 2030. The goal and objectives of the program kind of rely on three strategic axes. Number one, early detection and quick response to contain outbreaks. Number two, a multi-sectorial approach to prevent cholera recurrence. And number three, to provide an effective program of coordination between different healthcare professionals and agencies in order to contain in order to contain an outbreak, and also to reduce the prevalence and incidence of cholera outbreaks. So in summary, cholera is a very dangerous disease which has caused a lot of deaths in the past couple of centuries. Um, it is a waterborne disease, and most of the cases are usually found in developing countries. Our aim as healthcare professionals is to provide and to make sure that community members and people are provided with clean and portable water, which is free of any contamination. Um, and here are the references that I used. Thank you.